Hi, everyone, and welcome to our coronavirus booster for the week of March 15th. I'm Sam Alcaine, Assistant Professor in the Department of Food Science, here to spike your week with a little COVID 19 knowledge. All this month, I know many of you will be hitting important 1 year COVID 19 milestones. For me, this is the week I had to shut down the lab. So, where are we now, a year later? Well, let's look at the numbers. On cases of COVID 19, we are lower now than we were during our summer peak. And while it kind of looks like we're higher than the peak we had last spring, we didn't really have a robust COVID 19 detection system in place for the general population. So I'd be willing to wager that we're lower than where we were in the spring peak as well. Hospitalizations were lower both from our spring and our summer peaks, so that's good news. On deaths, we're lower than the peak we had last spring, but we're still above our summer peak. Now, this is all promising news, but we're still higher than all the troughs that we hit. So we really need to keep working on bringing those COVID 19 cases as low as possible. And of course, that means control strategies. And we have an important new tool that we didn't have last spring. That's right, vaccines. Now, we've updated our control strategies and added get a COVID 19 vaccine. So you, as an employee, what can you do? Protect yourself and get vaccinated as soon as you're eligible. What can you do as an employer, manager? Make sure you're educating your employees on the safety of the vaccines and the need to get them. Encourage them, provide incentives, and be an example. Get the vaccine yourself. Now, this new control strategy of vaccines is just rolling out, so it does not eliminate the control strategies below it. We still need to be practicing that social distancing of 6 feet, making sure that we still have the practices and strategies within our facility to maintain that 6 feet distance for our workers. We need to keep wearing our face coverings. We should still be screening our employees for COVID 19 symptoms, and if you have them, please stay home. Should be frequently washing our hands, avoid touching our faces, maintaining our cleaning and disinfection routines of frequently touched surfaces, and overall trying to minimize community spread. All of these control strategies together are really what's going to help us drive those COVID 19 cases even lower than we have since the start of this pandemic. Now, I imagine you might be saying, great, Sam, we want to put, vaccines as part of our mitigation practices and our control strategies, but when are we actually going to be able to get vaccinated? And I hear you. We were definitely hoping that food manufacturing workers would have already made the vaccine eligibility list. And in some states, portions of our food workers, like public-facing employees, have. Now, with the Moderna, Pfizer, and now Johnson & Johnson vaccines rollout really gaining steam, we are beginning to see some states like Alaska, Utah, and Michigan really throw open the doors and open vaccine eligibility to all within the state. And the federal administration is saying that they are planning to have vaccines available for everyone by May. So I suspect we're going to see other states rapidly expand their eligibility requirements. So if you haven't already started planning for a vaccine rollout in your facility, it's time to start. So how should you prepare for the vaccine rollout in your facility? Well, first off, make sure that you're encouraging your employees to get vaccinated as soon as they can. Make sure that you're directing them to reliable and vetted information on the different types of vaccines are available so that they feel comfortable and confident in getting it, because they should. There's information on the CDC website, on our Institute for Food Safety website. Make sure you're staying on top of vaccine eligibility. Some of your workers may already be eligible and may already be vaccinated, right? So if they meet the age requirements, if they are public-facing employees, they may be eligible. If they have underlying conditions, they may be eligible. Now, they don't need to tell you about those underlying conditions, but make sure they're aware of what underlying conditions make them eligible, right? Health conditions, so that they can then get vaccinated if they fall under those conditions. It's also really important to make sure that you give them time off to get vaccinated. I've heard various stories around how easy or difficult it is to get vaccinated. I've heard stories of people just walking into the pharmacy or into the vaccination site and 10 minutes later walking back out already vaccinated. I've also heard stories of people having to wait in line for a couple of hours before they could actually get their vaccine dose. So make sure that you are allowing them to have time off, and also for the first and second dose. And also we've also been hearing reports of some minor side effects for some of the vaccines like the Moderna and the Pfizer, where about 24 to 48 hours after the second dose, people report having chills, fatigue, low-grade fever, so they may not be coming into work the next day. Again, don't penalize them. We really want them to get vaccinated, and usually it's about 24 to 48 hours, and then they're good to go and back to normal to come to work. So please encourage it and make it easy for your employees to get vaccinated. Also, you're going to need to be then managing mixed vaccination scenarios, right? Some people are going to have the vaccine, some people aren't. Remind everyone that for the short term, at least, maybe short to midterm, you're going to really need to maintain all those mitigation practices. We still are going to need, even if you're vaccinated, you're going to need to wear your face coverings. You're going to need to practice social distancing, especially when not everyone has the same conditions. So stress fairness, stress protection of your coworkers by maintaining these mitigation practices. And remember that the short-term to midterm outlook for COVID-19 is partly cloudy. We're seeing sunlight. These vaccines are really going to make a difference. But we've also heard about some variants out there that may or may not be as effectively controlled by the vaccines, and it's still kind of early, so we need to watch out and see what's going to happen, right? We have summer coming up in the south, where a lot of people are going to start going indoors into air-conditioned environments. We saw peaks last summer, so we may see them again. Let's understand if we do or if we don't. If we don't see one, that's a great sign that these vaccines are controlling a wide range of variants and that we can feel more confident about then reevaluating the mitigation practices that we have in place. And then, of course, we're going to have to look further out to the fall in the north when things get cold and everyone starts going back indoors. So I think those are some of the key pieces that we're going to have to watch out for to understand how COVID-19 is going to continue to shape the way we work. And that's your coronavirus booster for March 15th. I hope you're looking forward to the spring. I know I am. I'm ready to get outside and enjoy some warmer weather. Please stay safe by practicing social distancing, wearing your face coverings, and regularly washing your hands with soap and water or using the appropriate sanitizer. And please get vaccinated as soon as you're eligible. Look forward to seeing you next time. Cheers.